What is the average effectiveness rate of the flu vaccine? Have you ever wondered how effective the flu vaccine really is? The effectiveness of the flu vaccine can change from year to year. This is mainly due to how well the vaccine strains match the circulating influenza viruses. On average, the flu vaccine is about 40% to 60% effective when the strains closely match the viruses in circulation. This means that the vaccine can reduce the risk of getting the flu by roughly 40% to 60% across the general population. However, there are years when the effectiveness is lower. For instance, if the vaccine strains do not match the circulating viruses well, the effectiveness may drop below 40%. On the other hand, in years when the vaccine matches the circulating strains very well, effectiveness can be higher than 60%. Younger and healthier individuals tend to experience higher effectiveness compared to older adults or those with weakened immune systems. The flu vaccine works by helping the immune system produce antibodies against the influenza virus strains included in the vaccine. Even if the vaccine does not completely prevent infection, it often lessens the severity of the illness, lowers the risk of hospitalization, and reduces complications related to influenza. Influenza viruses are constantly changing, which is why flu vaccines are updated every year. This yearly reformulation aims to target the most common strains expected for the upcoming flu season. This is a key reason why the effectiveness of the flu vaccine can vary significantly from one season to the next. In summary, the average effectiveness rate of the flu vaccine typically falls between 40% to 60% in preventing influenza during seasons with a good match. Despite this moderate effectiveness, getting vaccinated remains the best way to lower the chances of flu-related illnesses, hospitalizations, and even deaths. Health authorities, including the Centers for Disease Control and Prevention and the World Health Organization, recommend annual vaccination for most people, especially those at higher risk of severe flu complications. Always consult with healthcare professionals for personalized medical advice.